reduce health care costs, preserve plan choice, and lower premiums for the American people. However, here we are, a decade and a half later, and it is obvious the Democrats' promises have not proven true. Health care spending has only increased, plan options have been depleted, and the American people are being crushed by the unaffordability of the one-size-fits-all government-first approach Obamacare codified. My friend, the ranking member, talked about before healthcare, before Obamacare. Well, we know since its passage, healthcare premiums in the Obamacare marketplace have increased by 80%. Deductibles are now on average $5,000, and the average out-of-pocket maximum sits at over $20,000. All the while, Obamacare policies redirected trillions in taxpayer dollars to big health insurance companies. Without a doubt, Obamacare has proven to be unaffordable. Seizing the opportunity of the COVID-19, Democrats passed temporary enhanced taxpayer-funded subsidies that go to big insurance plans. These temporary COVID credits were designed to mask the unaffordability of Obamacare, and they were passed not once but twice without a single Republican vote. Democrats have now argued that these additional subsidies should be permanent. But let's not forget how we got here. It was Democrats that set up these credits to expire at the end of this year. When they were in charge, they chose not to make them permanent. If these subsidies are as essential as the rhetoric today would suggest, why would they choose to allow them to expire? Because in that same legislation, again passed with only Democrat votes, they chose to prioritize tax credits for the wealthy to buy electric vehicles and sent $27 billion to Democrats' politically connected friends through the Greenhouse Gas Reduction Slush Fund, including $2 billion that went to a group that only had $100 in previous year revenue. Instead of making these enhanced tax credits permanent, since the Democrats created these temporary COVID credits, we've seen an explosion of waste, fraud, and abuse that has exacerbated a major affordability crisis and hurt millions of Americans across the country. How have Democrats responded to this? By shifting the blame of their own failed policies onto Republicans, attempting to force legislation that would continue to send hundreds of billions of dollars straight to the coffers of big health insurance plans, and turning a blind eye to the growing evidence of widespread Obamacare fraud. They'd rather put a Band-Aid on rising health care costs, masking their true impact on American families, rather than focus on policies to actually address the issue. The most frustrating part of all of this is that healthcare affordability is a real issue impacting all Americans. And in the past, Republicans and Democrats have worked together to pass policies that would have a real impact on lowering costs for everyone. Instead of working to pass policies that would implement real, lasting solutions to lower healthcare costs for all Americans, Democrats have chosen the partisan path in an attempt to turn their own Obamacare policy failures into political points. I'm proud of the policies the Republicans have worked on as part of the Lowering Healthcare Costs for All Americans Act, because they do exactly what the title of the bill says: advance real policies that lower costs for all Americans. The bill includes bipartisan policies that would finally take the first steps to hold the drug industry middlemen, the pharmacy benefit managers, accountable to their own customers, the American people. Policies in the Lowering the Healthcare Costs for All Americans would shine a light on nefarious practices perpetrated by these middlemen and lower drug costs for all. The Lower Healthcare Costs for All Americans Act would finally appropriate funds for cost-sharing reductions. This policy reduced ACA premiums by 11%, an even greater saving than extending the temporary COVID credits. Funding CSRs has also enjoyed broad bipartisan support in the past, and it is a policy that was previously endorsed by my friends, Ranking Member Pallone, Ranking Member Neal, Ranking Member McGovern, who signed this letter to President Trump that said, and I'll quote, "Working families in every state are relying on you to pay cost-sharing subsidies to help ensure that they can afford the health care they need. The stability of the nation's health care system and health of millions of Americans now rest in your hands. Their health care coverage is not a bargaining chip." I hope that we can work across the aisle to support this common sense bill that will, without a doubt, increase health care affordability for all Americans. I also hope in 2026, Democrats will choose to rise above the politics and work with Republicans to advance real policy solutions that build on provisions included in the Lower Health Care Costs for All Americans Act to make health care even more affordable for the American people. Thank you, Madam Chair, and I yield back.